Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nutrition and Malnutrition. Learning objectives. By the end of the session, learners will be able to define the common terms used, educate mothers on children's nutritional needs, outline food safety and security, demonstrate techniques used in assessing the nutritional status, classify malnutrition, outline the causes of malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Infant and young child feeding. Nutritional education to mothers. What, when and how children are fed, particularly in the first 2 years of life, is critical to health, development, and survival. The early initiation of breastfeeding within the first hour of life. Feeding infants nothing but breast milk for the first 6 months of life. Exclusive breastfeeding is the safest and healthiest option for children everywhere and has great potential to save lives. Starting at 6 months of age, children's nutrient needs are greater than what breast milk alone can provide. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Micronutrient deficiencies. Micronutrient deficiencies are caused by inadequacy in intake of one or more vitamins and minerals essential for the prevention of malnutrition in all its forms, and reducing the prevalence of disease, especially during pregnancy and early childhood. Iodine deficiency, for example, the world's most preventable cause of impaired cognitive functioning, can lead to a variety of health and developmental consequences, including stunting and intellectual disability. For children living in countries where under 5 mortality is high and vitamin deficiency is a public health problem, vitamin supplementation provides vital protection from. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Food safety and food security. Food safety is an umbrella term that encompasses many facets of handling, preparation, and storage of food to prevent illness and injury. Food security exists when all people, at all times, have physical, social, and economic access to sufficient, safe, and nutritious food which meets their dietary needs and food preferences for an active and healthy life. Household food security is the application of this concept to family level, with individuals within households as the focus of concern. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Challenges to achieving food security. Water deficit to grow food crops. Land degradation. Climate change. Agricultural diseases. Plantation of non-food crops, i.e. tobacco, trees, etc., occupying land meant for food crops. Poor government support / policing. Food waste. Risks to food security / insecurity. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Food and food values. The daily values are reference amounts expressed in grams, milligrams, or micrograms of nutrients to consume or not to exceed each day. Balance plate for health should contain girl growing 5 food groups: grains, vegetables, fruits, meat, fish, and beans. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Malnutrition. By the end of the session, learners should be able to define malnutrition, outline the causes of malnutrition, immediate, underlying, and basic causes, state the signs and symptoms of malnutrition, list classification of malnutrition, mention the techniques used in assessing nutritional status, explain the management of malnutrition, list the complication of malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Causes of malnutrition. Immediate causes. Inadequate dietary intake. Diseases. Underlying causes. Food insecurity. Inadequate prevention and control of diseases. Basic causes. Control and management of resources, human, economic, organizational. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Classification of malnutrition. Acute is a condition where the body is getting too few of the required nutrients for a long period of time and is utilizing more than it is supplied, resulting to loss of weight. It is an indicator of current nutritional status, reflecting recent weight changes or disruption in nutrient intake. Most appropriate indicator to use in an emergency setting, e.g. during sudden or sharp period of food shortage associated with loss of body fats and severe wasting. Classified based on anthropometry measurement of size, weight, and proportion of the human body, biochemistry, and clinical assessment. Nursing and Midwifery Pediatrics Nutrition and Malnutrition. Chronic This is when the body is deprived of all or essential nutrients for long period of time, resulting into stunting. Is an indicator of nutritional status over time. Chronically malnourished children are short or stunted than their comparable age group. Clinical features: nastiness, severe wasting, old man's face, excess skin hangs around the buttocks. Nursing and midwifery pediatrics nutrition and malnutrition. Nursing and midwifery pediatrics nutrition and malnutrition. Crossover. Pitting feet, edema bilateral on both feet. Skin desquamation. Hair changes. Moon face. Appears adequately nourished due to excess extracellular fluid. Miserable skin changes, dermatosis. Hair changes, sunky straight, barely distributed, easily pluckable. Severe pallor. Marasmus kwashiorkor, most common form present with both. Nursing and midwifery pediatrics nutrition and malnutrition. Assessment of malnutrition in children aged 6 months to 5 years. The 4 key features or parameters used are: weight for height/length using her growth standard charts. Mid-upper arm circumferences using a measuring tape, cut off for. Severe malnutrition is 115 mm or 11 cm and below. Edema of both feet, bilateral pitting edema, kwashiorkor with or without severe wasting. Appetite test, ability to finish up the ready-to-use therapeutic food. RUTF. Nursing and midwifery pediatrics nutrition and malnutrition. Nursing and midwifery pediatrics nutrition and malnutrition. How to perform appetite tests. Assess all children above 6 months for appetite at the initial visit and at every follow-up visit to the health facility. Arrange a quiet corner where the child and mother can take their time to eat RUTF. Usually the child eats the RUTF portion within 30 minutes. Explain to the mother the purpose for assessing the child's appetite, what RUTF is, how to give RUTF, hand hygiene before giving RUTF. Encourage the child to eat without feeding by force. Nursing and midwifery pediatrics nutrition and malnutrition. Nursing and midwifery pediatrics nutrition and malnutrition. Nursing and midwifery pediatrics nutrition and malnutrition. Diagnostic criteria: moderate acute malnutrition, WFH/L between -3 z-scores and -2 z-scores, MUC 11 to 12.5 cm, low weight for age, severe acute malnutrition, without complication, edema of both feet, kwashiorkor with or without severe wasting, WFH/L less than -3 z-score, MUC less than 11.5 cm, visible severe wasting and able to diminish RUTF, with complication, edema of both feet, WFH/L less than 3 z-score, MUC less than 11.5 cm, visible severe wasting, not able to finish RUTF, plus any of the medical complication or danger signs present. Nursing and midwifery pediatrics nutrition and malnutrition. Management of malnutrition. Management of acute malnutrition in children. General principle of management. Admit all children with danger signs, medical complications, pitting, edema, and those who fail appetite test for inpatient care and treatment. Isolate all infected cases. Children with good appetite and no medical complication should be managed as outpatient for uncomplicated SAM. Adequate facilities and staff to ensure correct preparation of nursing and midwifery pediatrics nutrition and malnutrition. Management of moderate acute malnutrition. Assess the child. Counsel the mother on the feeding recommendation. If the child has any feeding problem, counsel the mother and follow up in 7 days. Advise the mother when to return immediately, i.e. danger signs, difficulty in breathing, unconsciousness, severe dehydration, vomiting, everything. Follow up in 30 days. Reassess and reclassify. Nursing and midwifery pediatrics nutrition and malnutrition. Management of uncomplicated severe acute malnutrition. Treatment. Give oral antibiotics amoxicillin 40 ng/kgbd for 5 days. Rough for child more than 6 months. Counsel the mother on how to feed the child. Assess for possible infections, TB. Advise the mother when to return immediately. Follow-up care. After 7 days. Reassess condition and feeding. Nursing and midwifery pediatrics nutrition and malnutrition. If the child has complicated SAM, refer urgently to the hospital. If the child has uncomplicated SAM, counsel the mother and encourage her to continue RUTF feeding. If child has moderate acute malnutrition, advise mother to continue with RUTF, counsel her to continue on other feeds according to the age. Appropriate feeding recommendation. Tell her to return in 14 days. Continue to see the child every 14 days until there is no more acute malnutrition. If no acute malnutrition, praise the mother, stop RUTF and counsel her. Nursing and midwifery pediatrics nutrition and malnutrition. Management of complicated severe acute malnutrition. Initial treatment is aimed to detect, treat, and prevent common and life-threatening complications, and med all severely malnourished children. Initial stabilization phase where the acute condition's complications are managed, e.g. S. hypothermia, H. hypoglycemia, I. infection, L. electrolytes. Nursing and midwifery pediatrics nutrition and malnutrition. Stabilization rehabilitation. Day 1 - 2, day 3 - 7 weeks 2 - 6. Hypoglycemia, hypothermia, dehydration, electrolytes, infection, micronutrients, no iron with iron, cautious feeding, catch-up crew. Nursing and midwifery pediatrics nutrition and malnutrition. Nursing and midwifery pediatrics nutrition and malnutrition. If able to drink, give first feed of F-75 therapeutic milk if available every 30 minutes. For 2 hours, then continue with feeds every 2 hours for 24 hours. If unconscious, treat with Rumen-4 10% glucose at 5 ml/kg if unable to access the Rumen-4 line. Give NGT with 10% glucose or sucrose solution. Monitoring. If initial blood glucose was low, repeat measurement after 30 minutes. If blood glucose falls below 3 ml/L, repeat 10% glucose or oral sugar solution and ensure antibiotics have been given. Nursing and midwifery pediatrics nutrition and malnutrition. 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 4. Correct electrolyte imbalance. All SAN children have deficiencies of potassium and magnesium, which may take up 2 weeks to correct. Edema is partly due to potassium deficiency and sodium retention. Do not treat edema with diuretics, and giving a child extra sodium would kill the child. Treatment. Give extra potassium 3 - 4 ml/kg per day. Give extra magnesium 0.4–0.6 ml/kg per day. Add Rosomal to hydrate. Nursing and midwifery pediatrics nutrition and malnutrition. 5. Treat or prevent infection. In all SAM, usual signs like fever are usually absent, yet multiple infections are common. Assume all SAM cases have infection and treat with antibiotics immediately. NPE, hypoglycemia, and hypothermia are often signs of severe infections. Treatment. Broad-spectrum antibiotics. Benzopenicillin. Nursing and midwifery pediatrics nutrition and malnutrition. Measles vaccination. If child is or equals 6 months and not vaccinated or was vaccinated before 9 months of age, delay vaccination if child is in shock. Treat other specific infection if diagnosed as appropriate, e.g. malaria, meningitis, etc. If parasitic worms are diagnosed, delay treatment until the rehabilitation phase. Give albendazole 200–400 mg single dose. If endemic, give mebendazole orally twice daily for 3 days to all SAM children 7 days after admission. Nursing and midwifery pediatrics nutrition and malnutrition. 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 Nursing and midwifery pediatrics nutrition and malnutrition.